Good morning to one and all, my dear student. Today's topic for discussion is necrotic enteritis in poultry. This is a disease caused by bacterial infection, in particular the Clostridial perfringens, which causes or which is responsible for necrotic enteritis in poultry. You must have learned about various species of Clostridium bacteria like Clostridium septicum, Clostridium nevi, Clostridium novi, Clostridium perfringens. Out of them, Clostridium perfringens is very notorious in case of poultry. We shall talk about this particular bacteria which is responsible for necrotic enteritis in poultry. This is more commonly or more popular with abbreviation NE. Also, it is commonly known by another name like Clostridial enteritis or in avian enterotoxemia, or sometimes it is also referred as rot gut in case of poultry. Uh, this is particularly caused by the type C toxins of Clostridium perfringens. This bacteria is basically a gram-positive toxin-forming, spore-forming anaerobic bacteria. You must be knowing, my dear student, that Clostridia, including Clostridium perfringens, are normal inhabitant of poultry gut. But when the microflora of the gut get imbalanced or get disturbed due to sudden change in feeding habit or feed formulation, then the bacteria which are normal inhabitant of GIT, they become potentially pathogenic and begin to produce toxins and various proteolytic enzymes, which in turn become damaging or tissue damaging or having tissue damaging toxins, which causes ultimately necrotic enteritis. We will deal it in detail in later slides, in later half of this lecture. Apart from this shoal Clostridium perfringens, there are so many predisposing factors which are responsible for causation of necrotic enteritis in poultry. They are microfloral disturbances. They are responsible for, better to say, they are responsible for microfloral disturbances in the GIT of the poultry. They include various kind of intestinal infections caused by coccidiosis, and in many cases infectious bursal disease is also responsible for intestinal infection, which ultimately invite the Clostridium perfringens to do a notorious or to perform pathology on intestinal lumen. Another factor which are responsible for predisposition of necrotic enteritis is nutritional factors like protein energy malnutrition. In many cases, vitamin E or selenium deficiency make the intestinal health vulnerable for Clostridium perfringens. Grain sources or diet change in the diet of poultry also in an important predisposing factors for Clostridium perfringens infection. Apart from nutritional infection and intestinal infection, managemental aspects also plays an important role in predisposing the bird to Clostridium infringens, like type of litter, timing of feed change, antibiotic treatment. All these changes make the poultry vulnerable or predisposes the bird to the infection caused by Clostridium perfringens. As far as susceptibility is concerned, necrotic enteritis is an acute infectious disease that affects mainly young broiler type of chicken, and as far as turkey is concerned, they are susceptible between the age bracket of 4 to 12 week of age. Older chicken and turkeys are also sometimes quails also are not usually affected by necrotic enteritis, but are more often affected by ulcerative enteritis. You must be knowing, my dear student, that Clostridium perfringens causes diseases in sheep and goat, or fetal diseases in case they causes fetal diseases in sheep and goat. You will find natural outbreaks of necrotic enteritis mostly in the age bracket of 2 weeks to 6 months of age in the broiler chicken, and majority of necrotic enteritis problems are identified in the broiler raised on litter. That is why we have I have told you that that sometimes managemental change in managemental condition predisposes the bird for necrotic enteritis. Now we will switch over our discussion on the sign and symptoms of the necrotic enteritis. Loss of appetite is one of the most common symptoms at the onset of necrotic enteritis. The bird become acutely depressed and die within an hour sometimes. Mortality is usually between 2% to 15%, but losses caused by emaciation, retarded growth, poor feed conversion efficiency may be even more costlier than the mortality caused by necrotic enteritis. As far as pathogenicity is concerned, just now I had discussed that how this Clostridium perfringens are normal inhabitant of poultry gut, but they become infectious, or they become responsible for causation of necrotic enteritis when bird gets altered feeding habit or deficient managemental condition. In such condition, this Clostridium perfringens found produces toxins in the gut of the intestine, or in the lumen of the intestine, better to say, and they migrates to the small intestine when they are predisposes to various factors which I have narrated just now. The small this bacteria, I mean Clostridium perfringens, first migrates to the small intestine, wherein they produces type C toxin in the small intestine. These type C toxins further destroy the epithelial cells of intestine, which make some small ulceration, and this causes bloody diarrhea, or ultimately this leads to hemorrhagic enteritis and sometimes ulcerative enteritis in case of poultry. So this is how the Clostridium perfringens are responsible for causation of necrotic enteritis or ulcerative enteritis due to their type C toxins in the poultry. Now we will talk about the clinical signs and symptoms shown by the bird affected by necrotic enteritis. Usually it can be classified or divided on the basis of clinical signs shown by the bird into acute clinical form and subclinical form. This acute clinical form could be seen at any age of the bird, but mostly it is found on young chickens, or better to say that necrotic enteritis is primarily a disease in young chickens, showing severe depression, reluctance to move, and frequent or consistent diarrhea with ruffled feather, and sudden death will be noticed in case of acute clinical form. While when we talk about subclinical form, wherein it doesn't causes acute mortality or high mortality, but the performance of the bird will be hampered in terms of weight loss, reduced gain weight, and impaired feed conversion efficiency ratio. As far as lesion is concerned, or necropsy lesion is concerned, you will find most of the time lesion in the lower half of the small intestine. Although sometimes the entire small intestine is affected, the wall of the intestine become engorged with blood and hemorrhages. The mucous membrane of the intestine in most of the cases become necrotic and may also have a diphthetic membrane which looks like cauliflower in appearance. So this cauliflower appearance in case of necrotic enteritis in the lower half of the intestine is a consistent or hallmark feature uh, shown by poultry affected with necrotic enteritis. You will find fibrinous necrotic enteritis also. Sometimes in milder form or subclinical form of necrotic enteritis, you may find focal area of intestinal mucosal necrosis. You will not find necrotic enteritis all along the length of lower half or most of the intestinal luminal length, but in case of mild form or subclinical form, you may find such lesion at some interval or in a different focal area. As far as diagnosis is concerned, a presumptive diagnosis could be done based on the history, clinical sign, and characteristic lesions. With typical gross and microscopic lesion and isolation and identification of the causative agent could be done for confirmation of Clostridial infection. As far as treatment is concerned, tetracycline will be the good choice by the clinician. When we talk about control measures for necrotic enteritis, vaccination of the breeder with inactivated vaccine based on the toxin inducing active and passive immunity have shown to offer good protection from necrotic enteritis, and the maintenance of microflora with the good management program will hamper the infection or hamper the prevalence of necrotic enteritis in the management. One can do better management, little management. One should better administer the coccidiostat in the feed formulation. Nutritional factor must be kept in mind while for feed formulation for the different age group of the bird, particularly while in the young age. So this is all about necrotic enteritis or Clostridial enteritis, or better to say avian enterotoxemia. Now the session is open for discussion. Your queries are most welcome. If you have any query, please come.